tuning into this annual Notice of Change video. My name is Emily Back, and I'm a licensed agent and Medicare expert here at Blue Cross and Blue Shield of Minnesota. First, I want to thank you for choosing Blue Cross. Your membership, health, and well-being are our top priorities. As a reminder, the annual election period runs from October 15th through December 7th. This is your time to review your coverage and to make sure that it's still a good fit for you. If it is, you don't have to do anything, and your plan will automatically renew into next year. Nice and easy. However, if you do have questions or want to make a change, feel free to give me a call, email, or visit my website to set up an appointment. I'm available for appointments over the phone, through Zoom, or even in person. You may have heard that Blue Cross is #1 in Medicare in Minnesota. So if you know anybody who's considering choosing Blue Cross for their health plan, feel free to share my information. The best compliment you can give me as your agent is to send referrals my way.
All right, we have a lot of content to cover today, so let's get started. Today, I'm going to be giving you a little reminder on how your original Medicare benefits work, and that'll show you why your cost plan, Advantage plan, and Medicare supplements are so important to have. And then I'll get into giving you updates on what your plans will look like for next year in 2023. This first slide is probably a reminder for most of you, but still helpful nonetheless. This slide is going to review when you can actually sign up for Medicare. Most people will sign up for Medicare surrounding their 65th birthday. However, it could be sooner if it's due to a disability. If you do sign up surrounding your 65th birthday, this is called your initial enrollment, also known as the initial coverage election. If you were to apply during this window of time, you've got a 7-month window to get that done. 3 months before your birthday, the month of, and 3 months after. There's also other windows of time that you can enroll into Medicare using a special enrollment period. The most common example of this would be if someone decided to continue working past age 65 and then retires at a later date, say when they're 70, for example. Because they're leaving employer coverage, this gives them a special enrollment period to sign up for Medicare at that time. At the bottom of the screen, we have windows of time that you can change your coverage if you're already on a Medicare plan. The annual election period, also known as AEP, runs every year from October 15th through December 7th. You can make any changes that you need during this window of time, and those changes will kick in January 1st of the following year. If you are a Medicare Advantage plan member, you have even more flexibility with an additional window of time that you can change your coverage. This runs every year from January 1st through the end of March. Rest assured that if your health needs change, you have the flexibility of changing your plan as well. Reach out to your agent or to us here at Blue Cross if you have any questions on this. Now, let's take a look at your original Medicare benefits, known as Medicare Part A and Medicare Part B. This is always a helpful reminder as to why it's so important to have additional coverage, either through a Medicare Advantage plan, supplement plan, or a cost plan. On the left-hand side of the screen, we have Medicare Part A. Medicare Part A is going to kick in if you have to spend the night in the hospital. Most people don't pay a premium for Medicare Part A because you already have paid through your taxes when you are working. There is a deductible, however, and that deductible resets every 60 days, and that's what Medicare calls a benefit period. The deductible is $1,556 for days 1 through 60. If someone were to stay in the hospital beyond 60 days, they would then tap into a copay of $389 a day. And after day 90, now you'd be tapping into what Medicare calls your lifetime reserve days. The copay during this window of time, from days 91 through 150, would have a copay of $778 a day. Once you use these days, Medicare would not make any further payments, and you would be paying out of pocket on your own. Medicare Part B on the other side of the screen is going to cover you for more of your day-to-day doctoring. Things like office visits, lab work, outpatient hospital procedures, and medical equipment will all fall under Medicare Part B. There is a cost associated with having Medicare Part B, and most people will pay $170.10 per month. However, it could be more depending on what your income is. Medicare and Social Security will be the ones to assign that amount to you. As far as the benefits go, Medicare Part B has a $233 deductible And after that's met, you would pay 20% and Medicare will cover you at the other 80%. One of the most important things to be aware of is that Medicare does not have an out-of-pocket maximum. This might be one of the biggest reasons Medicare recipients decide to enroll into an Advantage, Supplement, or Cost plan. Some other surprising items that Medicare does not cover would be inpatient hospital stays beyond those day limits we talked about. Certain routine care would also not be covered by Medicare. Examples of this would be your routine annual physical beyond a wellness exam, routine hearing, vision, and dental care. Most care received outside of the United States would not be covered. And prescription drugs that you pick up at the pharmacy are not covered by Medicare. That's why you would need to purchase a prescription drug plan, also known as Medicare Part D. Now, before I get into giving you updates on your plan for next year, I'd love to share a few really cool facts about Blue Cross here in Minnesota. Blue Cross has been around for over 90 years, and about half of all Minnesota seniors have a Blue Cross plan. Blue Cross is known for having a really large network, and about 96% of Minnesota hospitals and clinics are included in the plan, so you're covered just about anywhere you want to go. Blue Cross of Minnesota is proud to be a nonprofit healthcare company, and we're also happy to say that you can rely on our customer service that is local here in Minnesota to get guidance and support on your health plan. Today, I'm going to be reviewing the changes to our Medicare cost plan, also known as Platinum Blue. I'll also be reviewing our Medicare Advantage plans for Western, Southern, and the metro areas of Minnesota. I'll also talk about our Medicare supplement plans and our prescription drug plan called Medicare Blue RX. These plans are offered regionally, so make sure that you're tuning into the plan that applies to you in the county that you live in. Let's start out by reviewing our Platinum Blue cost plan changes for 2023. We have 3 different options for our Platinum Blue plans, starting at $29 per month. You have the option of combining your prescription drug coverage with your medical plan to get the convenience of having one plan, one card, and just one invoice to pay each month. You have a large network of doctors to choose from, including 96% of doctors and clinics statewide. You don't need a referral to see a specialist on these plans, and you have great travel benefits. You can still travel up to 9 months of the year and use the plan in any of the 50 states, just like you do here in Minnesota. If you're traveling internationally, you can also rest assured that you have emergency coverage still while you're outside of the United States. As a reminder, Platinum Blue is a cost plan, and cost plans are annual contract plans. This means that your benefits can change from year to year, but keep in mind that you also have the flexibility of changing your plan as well if your health needs change. Let's start out with giving you some premium updates for next year. Our core plan medical only option will be $29. And if you bundle prescription drug coverage, your premium will come to $52.40 per month. Our Platinum Blue Choice plan, medical only, will be $114. And with drug coverage, that premium will come to $158.20 per month. Finally, the complete plan will be $189 per month for the medical only option and $255.10 if you bundle it with prescription drug coverage. The medical deductible will remain the same at $0 on all 3 plans, and that means that you don't have to pay anything up front before your benefits kick in. Your out-of-pocket maximums will also remain the same on all 3 plans. Just as a reminder, every time you pay a copay on your Platinum Blue plan, Blue Cross is keeping track of it. If you ever end up paying one of those amounts on the screen, depending on which plan you choose, Blue Cross will kick in and cover you at 100% for the rest of the calendar year, as long as you're following plan guidelines. Moving into copay updates, we don't have many notable changes here. If you have the Platinum Blue Choice plan, your specialist copay will be $20 next year in 2023. Other than that, no other changes to your medical plan copays for 2023. Just to call out some of the big benefits, though, that our members do ask about, lab work will still be covered at 100% on all three plans, as well as diabetic supplies like your test strips and meters. And your inpatient hospital copays will still be the same on all three plans for next year as well. Moving into your prescription drug coverage, this slide will apply to you if you bundle your drug coverage with your Platinum Blue medical plan. There's just a few changes for next year, and let's start out talking about the drug deductible. The core plan drug deductible will be $505 for next year, and the choice and complete plans will have a $505 deductible for brand name medications next year. As for copay and coinsurance changes, on the core plan, your out-of-pocket costs will actually be going down, and you'll have an $11 copay for Tier 2 medications. You'll pay 22% for Tier 3 medications and 44% for Tier 4 prescription drugs. On the choice plan, you'll pay 21% of the negotiated rate on Tier 3 medications and 42% for Tier 4s. And lastly, on the complete plan, just one notable change to the Tier 4 drug category, where your out-of-pocket costs will again be going down, and you'll be paying 40% of the negotiated cost of the drug. This slide is likely a reminder for most of you, but let's review what the coverage gap is. This is sometimes also referred to as the donut hole. Once you and your insurance company, Blue Cross in this case, pay a certain amount of money for a medication, then your costs will go up. This coverage gap is on every drug plan in the country, so it's not specific to us here in Minnesota or to Blue Cross Medicare plans. And it really depends on what medications you take, on whether or not you'll even come close to hitting this. If you take a few generic drugs, your chances of hitting this are very slim. However, if you do take several more expensive brand name medications, your chances of hitting this are a bit higher. To break down the numbers for you, once you and Blue Cross pay a total of $4,666 for medication, now you are in the coverage gap and your costs will go up. You'll pay 25% of the cost of your medication until you on your own have paid a total of $7,400 for medication. Then your costs will go down a bit and you'll pay either a copay of $4.15 for generic drugs, $10.35 for brand name drugs, or 5% of the cost of the medication, whichever is higher. If you do have questions on this, contact your agent or give us a call at Blue Cross and we are happy to help. Your Platinum Blue Choice and Complete plans will still be covering your preventive dental services next year, but we're also going to be adding in an additional periodontal cleaning. So you can now get 2 periodontal cleanings per year. The other services like your routine cleanings, exams, and x-rays will be unchanged and remain the same next year in 2023. As far as the extras go on the Platinum Blue plans, we are still going to have the same extra benefits that our members love, like the Silver Sneakers program, over-the-counter medication allowance, vision reimbursements on our Choice and Complete plans, and dental, which we already discussed. The only notable change will be to the acupuncture benefit, where in 2023, your Platinum Blue plan will be covering 12 acupuncture visits for any pain diagnosis. The copay will still be the same copay as if you were going to see the chiropractor. Let's start out with updates to our Medicare Advantage plan that's available in Western Minnesota. We have 2 pretty big and notable changes to our Medicare Advantage plans that are available in Western Minnesota. The first is that anyone living in Sherburne or Wright County will now fall under the Metro Minnesota Medicare Advantage plan category. So if you live in Wright or Sherburne County, you'll want to make sure that you tune into the Metro Medicare Advantage plan portion of this presentation. Another change that's rather exciting is we have a new plan option that's going to be available to residents living in Western Minnesota. The plan is called our Medicare Advantage Comfort Plan, and I'll review the benefits with you on the next couple of slides, as well as give you updates to the current plans that we offer as well for next year. Good news, you still do not need a referral to see a specialist when you're on a Blue Cross Medicare Advantage plan. And our network is still as big as ever, including 96% of doctors and clinics in the state. This plan does come packaged with prescription drug coverage, so you don't have to buy a separate drug plan. Your travel benefit is still remaining the same, where you can travel up to 9 months of the year, and you can use your plan in all 50 states, just like you do when you're here at home in Minnesota. Let's start out with premium updates. The core plan will remain at $0 with no cost to you. The choice plan will be $97 per month, and our complete plan will be $211 per month. Keep in mind, the complete plan is the plan that covers insulin on our drug list at 100%. The in-network out-of-pocket maximum will be changing on the core and choice plans, and it'll be $5,800 for the core plan and $3,100 on the choice. The health plan deductible will remain at $0 on all 3 of our Advantage plans, as well as the new Comfort, meaning that you don't have to pay anything up front before your benefits kick in. To give you an overview of our new Comfort plan, the monthly cost will be $67, and it has a $3,700 in-network out-of-pocket maximum and $6,300 combined in and out-of-network out-of-pocket maximum. If you see an out-of-network provider, you would pay 40% of the cost if you had the new Comfort plan. Moving on to copay updates. Just a few changes here, starting with changes to the core plan. Your specialist copay will be $45. The outpatient hospital surgery copay will be $400, and your inpatient hospital stay copay will be $350 per day for days 1 through 5. If you have the choice plan, your specialist copay will be $35 in 2023, and your inpatient hospital stay copay will be $250 for your entire stay. There are no notable changes to copays on the complete plan. You'll still pay nothing for lab work as well as diabetic supplies like your test strips and monitors on all 3 plans. Now, to introduce you to how the Comfort plan would work, let's start out with office visit copays. If you needed to see your primary care doctor, you wouldn't pay anything and it would be covered at 100%. If you needed to see a specialist, you would have a $40 copay. Lab work and x-rays are covered at 100%, as well as diabetic supplies and mammograms and colonoscopies. Just an FYI, mammograms and colonoscopies are always covered at 100% on all 4 of our plans, whether it's routine or diagnostic. Your emergency room copay would be $90, and there's a $40 copay for urgent care. The ambulance copay on the Comfort plan will be $250, and that's the same copay whether you use a ground or air ambulance. An inpatient hospital stay will have a $350 copay for your entire stay, and Part B medication, like infusions and injections, would have a 20% cost to you. Now, let's review updates to your prescription drug coverage. On the core and complete plan, there's no changes to your deductibles or copays. If you're on the choice plan and take a Tier 4 medication, you'll now pay 42% of the negotiated rate and 29% of the negotiated rate for Tier 5 medications. Our new Comfort plan will have a $350 deductible for brand name medications and no copay for Tier 1 medication. Tier 2 prescription drugs will have an $11 copay, and Tier 3 medications will have a $47 copay. If you take a Tier 4 medication, you would pay 42% of the contracted rate and 27% if you take a Tier 5 medication. This slide is likely a reminder for most of you, but let's review what the coverage gap, also sometimes called the donut hole, is. Once you and your insurance company, Blue Cross in this case, pay a certain amount of money for your medication, then your costs will go up. This coverage gap is on every drug plan in the country, so it's not specific to us here in Minnesota or to Blue Cross Medicare plans. And it really depends on what medications you take, on whether or not you'll even come close to hitting this. If you take a few generic drugs, your chances of hitting it are very slim. However, if you do take several more expensive brand name medications, your chances of hitting this are a bit higher. To break down the numbers for you, once you and Blue Cross pay a total of $4,660 for medication, now you're in the coverage gap and your costs will go up. You'll pay 25% of the cost of your prescription drugs until you on your own have paid a total of $7,400 for medication. Then your costs will go down a bit and you'll pay either a copay of $4.15 for generic drugs, $10.35 for brand name drugs, or 5% of the cost of the medication, whatever is higher. If you have questions on this, contact your agent or give us a call here at Blue Cross and we can help. Moving on to dental updates. An additional periodontal cleaning will be included under the dental benefits on all plans. That means if you need to get 2 periodontal cleanings, they would both be covered at 100% for the year. The annual plan maximum on the choice plan will change to $1,500. On our new comfort plan, you'll have an annual plan maximum of $1,500, preventive dental, as well as coverage for more complex services like fillings, extractions, root canals, and crowns that you can see there on the screen. As far as the extras go on the Advantage plan, we're still going to have the same great benefits that our members love, like the Silver Sneakers program, over-the-counter medication allowances, and those will actually be increasing to $50 per quarter on all plans. Dental, which we've already discussed, and you'll still have vision coverage along with reimbursements for eyewear. There will be a change to the acupuncture benefit in 2023, and your Advantage plan will be covering 12 acupuncture visits for any pain diagnosis. The copay will be the same copay as if you were going to see your chiropractor. Let's start out with reviewing our Medicare Advantage plan that's available in Southern Minnesota. Good news, you still do not need a referral to see a specialist when you're on a Blue Cross Medicare plan. And our network is still as big as ever, including 95% of doctors and clinics in your area of Minnesota. The plans still come packaged with prescription drug coverage, so you don't have to buy a separate prescription drug plan. Your travel benefit is still remaining the same, where you can travel up to 9 months of the year and use your plan in all 50 states, just like you do when you're here at home in Minnesota. Let's review the premium updates for 2023. The core plan will be $43 per month. The choice plan will be $139 per month. And the complete plan will be $212 per month. Out-of-pocket maximums will be unchanged for next year, and you'll still have no health plan deductible on all 3 plans. This means that you don't have to pay any money up front first before your benefits kick in. The only notable change to copays will be on the core and choice plan. On the core plan, if you have an inpatient hospital stay, you'll have a copay of $350 for days 1 through 5. On the choice plan, your inpatient hospital copay will be $250 for your entire stay in 2023. Another change on the choice plan, there will be a $250 outpatient hospital surgery copay in 2023. The prescription drug benefits will remain the same on the complete and core plans, and there will be 2 minor changes to the choice plan. If you're on the choice plan, taking a tier 4 medication, your costs will be going down, and you'll pay 40% of the contracted rate for the medication and 29% for tier 5 prescription drugs. Moving into the coverage gap, let's start out with a little reminder on what this is, and it's sometimes referred to as the donut hole. Once you and your insurance company, Blue Cross in this case, pay a certain amount of money for your prescription drugs, then your costs will go up. This coverage gap is on every drug plan in the country, so it's not specific to us living here in Minnesota or to Blue Cross Medicare plans. And it really depends on what medications you take, on whether or not you'll even come close to hitting this. If you take a few generic drugs, your chances of hitting this are very slim, However, if you do take a bunch of brand name medication or specialty medications, your chances of hitting this are a bit higher. To break down the numbers for you, once you and Blue Cross pay a total of $4,660 for medication, now you're in the coverage gap and your costs will go up. You'll pay 25% of the cost of your medication until you on your own have paid a total of $7,400. Then your costs will go down a bit and you'll pay either a copay of $4.15 for generic drugs, $10.35 for brand name drugs, or 5% of the cost of the medication, whatever's higher. If you have questions on this, feel free to give your agent a call or contact us here at Blue Cross and we're happy to help. Your dental benefits will remain the same for next year with the same benefit maximum of $2,000 per calendar year. The core plan will still be covering your preventive dental, and the Choice and Complete plan will have the same benefits for more comprehensive services like fillings, root canals, and extractions. An exciting addition will be to the periodontal cleanings. We are able to add in one more periodontal cleaning covered at 100% on all three plans next year. As for the extras go on the Medicare Advantage plan, we're still going to have the same great benefits that our members love, like the Silver Sneakers program, over-the-counter medication allowances, which will be increasing to $50 per quarter on all plans, dental, which we already discussed, and you'll still have vision coverage along with reimbursements for eyewear. There will be a change to the acupuncture benefit in 2023, and your Advantage plan will be covering 12 acupuncture visits for any pain diagnosis. The copay will still be the same copay as if you were going to see a chiropractor. Let's start out with changes to the Medicare Advantage Metro plan. Some new exciting things that were added into our Metro plan option. First of all, we have 2 more counties that are going to be considered Metro Minnesota County. If you do live in Wright or Sherburne County, you will now be considered part of the Metro Minnesota plan. We also have a new plan that we're offering next year in 2023 called our Comfort Plan, which I will go over all of the copays and how it works on the next few slides with you. We still have the same great benefits where you do not need a referral to see a specialist on all Blue Cross Medicare plans. And our network is still as big as ever, including 96% of doctors and clinics in Minnesota. You still have travel benefits, so you can use your plan in all 50 states, just like you do here in Minnesota. You can travel up to 9 months of the year as long as you live in Minnesota for at least 3. And you can rest assured knowing that if you are traveling internationally, you have your same worldwide emergency benefits as well. Let's review premium updates for next year in 2023. The core plan will still remain with a $0 premium, so no cost to you. The Choice plan will be $86 per month, and the Complete plan will be $172 per month. Your out-of-pocket maximums and deductibles will remain the same. As a reminder, you have no deductible on any option here in the Blue Cross Medicare Advantage world. That means that you do not have to pay any money upfront first before your benefits kick in. Now, to give you an overview of the Medicare Advantage Comfort Plan that's new for next year, the monthly premium amount will be $56. Again, no health plan deductible. And there is an out-of-pocket maximum of $3,500 for in-network providers and $5,450 as a combined in and out-of-network out-of-pocket maximum. If you do see an out-of-network provider, you would pay 40% of the cost on the Comfort Plan. Moving into copay updates for next year. No notable changes on the core, choice, or complete plans. Your lab work and diabetic supplies are all still going to be covered at 100%. Visits with your primary care doctor will also still be covered at 100%, and no changes to your inpatient hospital stay copays. Now, to jump into the comfort plan, to let you know how that plan would work, your primary care doctor visits will be covered at 100%. If you needed to see a specialist, you would pay $35. Lab work along with x-rays would be covered at 100%. You would have a $75 copay for outpatient advanced imaging. That would be something like an MRI or a CAT scan. Diabetic supplies along with mammograms and colonoscopies would be covered at 100%. And just an FYI, mammograms and colonoscopies are always going to be covered at 100% on all 4 of our Medicare Advantage plan options, whether it is routine or diagnostic. You would pay 20% for medical equipment. You would have a $90 copay for the emergency room, $40 for urgent care, a $250 ambulance copay, and that'll be the same whether it's a ground ambulance or an air ambulance. You'll have a $275 copay for outpatient hospital surgery, a $350 copay for inpatient hospital stays, and for Part B covered medication, that would be 20% out of pocket to you. Moving into updates for prescription drug coverage. No notable changes on the complete and core plans. So jumping right into the choice option. If you take a tier 4 medication and you're on the choice plan, you would pay 42% of the contracted rate. And for tier 5 specialty medication, you would pay 29% of the contracted rate next year in 2023. As for the new comfort plan, there is no deductible for tiers 1 and 2 medications, and there would be a $300 deductible for your brand name prescription drugs. If you took a tier 1 medication, you would pay no copay on the comfort plan. Tier 2 medications will have an $11 copay. Tier 3 will be a $47 copay. Tier 4 medications will have a 42% coinsurance, and Tier 5 specialty medications would have a 28% coinsurance. This slide is likely a reminder for most of you, but let's review what the coverage gap, also sometimes called the donut hole, is. Once you and your insurance company, Blue Cross in this case, pay a certain amount of money for your prescription drugs, then your costs will go up. This coverage gap is on every drug plan in the country, so it's not specific to us here in Minnesota or to Blue Cross Medicare plans. And it really depends on what medications you take on whether or not you'll even come close to hitting this. If you take very few generic drugs, your chances of hitting this are pretty slim. However, if you do take several more expensive brand name medications, your chances of hitting this are a bit higher. To break down the numbers for you, once you and Blue Cross pay a total of $4,660 for medication, now you're in the coverage gap and your costs will go up. You'll pay 25% of the cost of your medication until you on your own have paid a total of $7,400 for medication. Now your costs will go down a bit and you'll pay either a copay of $4.15 for generic drugs, $10.35 for brand name drugs, or 5% of the cost of the medication, whatever's higher. If you have questions on this, contact your agent or give us a call here at Blue Cross and we can help. Moving into updates for the dental coverage that's included with your Medicare Advantage Metro plan. No notable changes here. Your annual plan maximum will still remain the same at $2,000 on all plan options, but we do have an exciting addition where we will be covering an additional periodontal cleaning for the year on all 4 plans. So if you do need 2 periodontal cleanings, those would be covered at 100% on all options. For the new Comfort Plan next year, you'll see that the annual plan maximum, like I mentioned, will be $2,000. Your preventive services, like your exams and cleanings, 1 set of x-rays and 2 periodontal cleanings, along with 2 fluoride treatments, will be covered at 100%. You're covered for fillings, and you would pay 30% of the cost. And other more complex services like root canals, extractions, implants, or crowns, you would pay 50%. As far as the extras go on the Advantage plans, we're still going to have the same great benefits that our members love, like the Silver Sneakers program, over-the-counter medication allowances, which will be increasing to $50 per quarter on all plans, dental, which we just discussed, and you'll still have vision coverage along with reimbursements for eyewear. There will be a change to the acupuncture benefit, and in 2023, your Advantage plan will be covering 12 acupuncture visits for any pain diagnosis. The copay will be the same as if you were going to the chiropractor. Let's move into updates for the Medicare supplement plans next year in 2023. Medicare supplement plans are still considered guaranteed renewable, so that means your benefits are locked in when you sign up for your plan. The only thing that can change, of course, is your monthly premium. The plans are still portable, so that means if you do decide to leave Minnesota and become a permanent resident of another state, that's okay, and you can take your plans with you. That also means that you've got unlimited travel within the United States, and you can go to any provider that accepts Medicare. Here are the premium updates for our Medicare supplement plans for next year in 2023. There are 2 different premium rates depending on when you were first eligible for Medicare. If you were eligible for Medicare benefits before 2020, this slide will apply to you. These prices are slightly higher because those who were eligible for Medicare before 2020 have access to buying extra coverage to cover the Medicare Part B deductible. If you were eligible for Medicare after 2020, the next slide will have your rates listed. If you have the high deductible plan and you were eligible for Medicare before 2020 and you're tobacco-free, your premium will be going down and it'll be $79.35. If you do not use tobacco, if you do use tobacco, your price will be $95.25. If you have Plan N and you were eligible for Medicare before 2020 and you're tobacco-free, your premium will be going down next year as well, and your price will be $182.60 per month. If you do use tobacco, your price will be $219.15. The basic blue monthly cost will be $272.20 if you're tobacco-free next year. Otherwise, it'll be $309.30. And Senior Gold will have a monthly premium of $300.55 if you're tobacco-free. Otherwise, it'll be $348.50. Another reminder, those prices I just quoted you are if you're eligible for Medicare before the year 2020. This slide will be reviewing premium updates to our Medicare supplement plans for those eligible for Medicare 2020 or after. There was a legislation change that went into effect in 2020 requiring Medicare supplement plans to stop covering the Medicare Part B deductible for those who became Medicare eligible in 2020 or later. This is why the premiums will be slightly lower, since these members are not able to buy coverage to pay for that Medicare Part B deductible. The high deductible and Plan N plans will both be going down in price for next year in 2023. The high deductible plan will be $59.95 if you're tobacco-free. Otherwise, it'll be $75.85. Plan N will be $182.60 if you're tobacco-free. Otherwise, it'll be $219.15 per month. Our basic blue plan will be $254.80 if you're tobacco-free. Otherwise, it'll be $289.90 per month. Finally, our senior gold plan will be $281.15 per month if you're tobacco-free. Otherwise, it'll be $329.10 per month. The premium amounts on this slide are what I just reviewed for you for those who are eligible for Medicare plans in 2020 or later. Medicare supplements are considered guaranteed renewable, which means your benefits are locked in and won't change. The only exception to that is what the deductible amount is on the high deductible plan, and Medicare sets that amount each year. As mentioned on the previous page, your benefits will remain unchanged in 2023 if you're on a Medicare supplement plan. Your copays will stay the same for office visits on Plan N, and all services will still apply to the deductible on the high deductible plan. The basic blue and senior gold plans will still remain the most comprehensive out of the 4 options for next year in 2023. Let's get into updates on our prescription drug plan, also known as Medicare Blue RX. You still have the flexibility of mixing and matching your drug coverage with your Medicare supplement plan. And this year we have exciting news. We are offering a new plan. Our new plan is called our Select Plan. The price for the Select Plan will be $17.30 per month, and it'll have a $505 deductible for brand name medication. The same pharmacy setup applies, where you'll get a bigger discount if you're able to utilize a preferred pharmacy. Copays on the Select Plan at preferred pharmacies are going to be the following. Tier 1 medication copays will have a $0 responsibility, and you'll be covered at 100%. Tier 2 drugs will have a $2 copay. For Tier 3 medications, you'll pay 21%. And for Tier 4 medications, you'll pay 40% of the contracted rate. Finally, for Tier 5 specialty medication, you'll pay 25%. Now, to review the changes with you to the standard and premier plans. The monthly plan premiums will be going down a bit, and the standard plan will be $80.70 per month, and the premier plan will be $113.60 per month. The deductible will be $505 for brand name medication on the standard plan, and will remain at $0 for the premier plan. Copays will be changing on the standard plan for tiers 1, 2, and 3 medications. Tier 1 prescriptions will have a $7 copay at a preferred pharmacy, $14 at a standard. Tier 2 will have a $12 copay at a preferred pharmacy and $19 at a standard. And Tier 3 medications will have a 45% coinsurance at a preferred pharmacy and 50% coinsurance at standards. For the Premier plan, there's just one notable change, and that's for Tier 3 medications, and you'll be paying 20% of the contracted rate for those in 2023. This slide is likely a review for most, but let's review what the coverage gap, also sometimes called the donut hole, is. Once you and your insurance company, Blue Cross in this case, pay a certain amount of money for your medication, then your costs will go up. This coverage gap is on every drug plan in the country, so it's not specific to us living here in Minnesota or to Blue Cross Medicare plans. And it really depends on what medications you take on whether or not you'll even come close to hitting this. If you take a few generic drugs, your chances of hitting this are very slim. However, if you do take a bunch of brand name medication or specialty medications, your chances of hitting this are a bit higher. To break down the numbers for you, once you and Blue Cross pay a total of $4,660 for medication, now you're in the coverage gap and your costs will go up. You'll pay 25% of the cost of your medication until you on your own have paid a total of $7,400. And then your costs will go down a bit and you'll pay either a copay of $4.15 for generic drugs, $10.35 for brand name medication, or 5% of the cost of the medication, whatever's higher. The only exception to this would be if you're on the Premier plan. If you're on the Premier plan and you're taking a Tier 1 or 2 drug and hit the coverage gap, you'll still be covered at 100% for your medication if you're picking it up at a preferred pharmacy. If you have any questions on this, contact your agent or give us a call at Blue Cross and we'd be happy to help. Now, just a little reminder on why it's so important to have prescription drug coverage. If you don't take drug coverage when you're first eligible for Medicare, Medicare will tack on a penalty to your monthly premium if you do sign up one day. That penalty is not a one-time fee. It's actually something that you'll pay every month for as long as you're enrolled in prescription drug coverage. Ways to avoid this penalty: first off, get drug coverage when you're first eligible for it. If you have benefits through your employer, TRICARE, or through the VA, that counts as long as your coverage is considered creditable, which just means it's as good as or better than what you can get from Medicare. If you have a Medicare Advantage plan, your prescription drug plans would be automatically built into your coverage as well. To make sure that your coverage is creditable, contact your plan administrator or benefits contact to find out. My last slide here is just to acknowledge that medication can be very expensive, especially for those who hit the coverage gap or take specialty medications. If you or anybody you know is ever having trouble paying for prescription drugs, there's programs available to help lower deductibles, co-pays, and even monthly premiums. To find out more, you can contact Medicare, who's open 24 hours a day, 7 days a week. To apply, contact Social Security at the number listed on your screen.
Thank you for tuning into this annual Notice of Change video. I appreciate your membership with Blue Cross and hope that you found this video to be helpful and informative. If you have any questions, please don't hesitate to reach out at any time. If you know anyone who's considering Blue Cross for their Medicare plan, please feel free to share my contact information. I'd be happy to help. Thanks again and take care.